The topic of mental health and wellness is something that has been discussed for a number of years. But when it comes to reality TV, the intense environment and heightened emotions can lead to serious consequences for those involved. Recently, an alarming number of deaths have been associated with reality television and the effect that it can have on individuals. A magnifying glass has been placed over the duty of care that productions have to give to its participants, and whether enough support is offered both during and after filming. The issue is one that has an impact on all of those involved, both in front of the camera and behind it.
My name's Lauren and I worked as a casting researcher for ITV on Jeremy Kyle for 7 months, and I was there right up until the show ended, and obviously the whole inquest about reality TV stemmed from the Jeremy Kyle show ending.
Lauren's former role as a casting researcher is one of the many jobs within the TV industry that comes with a lot of pressure.
If you don't cast that show and if you don't have a contributor to come, you don't have a show. I think a lot of people in TV are affected by mental health because of that reason. It's very stressful and people don't realise that. I mean, you'd go in at 9 and the day before studio when you were busy, you wouldn't leave till about 3 a.m. in the morning most days. And I think that does take a massive toll on people as well. Like, you don't realise how hard it is. People think it's glamorous, but it's not at all.
In May 2019, ITV took the decision to cancel the Jeremy Kyle show after the death of one of its participants.
So we were told about the death of a contributor who'd come on the show the week before the show was actually cancelled. So we kind of had a bit of an insight that it was being suspended and taken off air for now. But I don't think any of us really thought that it was ever going to actually be cancelled forever. And then we were called in on the Monday to be told that it was going to be cancelled forever. And it was pretty upsetting for most people because there was a lot of staff who had been there since the show first started, and they'd worked their way up. They'd been there for 15 years. So it was pretty shocking, to be honest.
As a result of this incident, the British government launched an inquiry into reality TV and its welfare procedures.
The situation that happened with Jeremy Kyle, it was horrific and it's really sad, but I feel that they did everything that they could have done at the time to make sure that guests left happy. We had mental health nurses, Graham, the psychiatrist, and a load of other teams that would help them with the aftercare. But I guess when you're in a situation like that and when you're on TV and talking about such personal things, it can have a massive impact on you.
Following the government's inquiry, more pressure was placed on productions to provide a higher level of care for its contributors.
Personally, I don't think that the show exploited vulnerable people. I know a lot of people do say that. However, I feel like the show did give people a chance to tell their story, and it gave people a chance to do things or get things that they wouldn't have necessarily had the opportunities to get. However, I do think that there could be more steps that reality shows could take to properly protect its participants when they come out of the show.
Olivia Butler-Fagbohun was one of the first participants to experience reality television in its newly scrutinised state, when she took part in BBC Three's HouseShare less than a month after the inquiry was conducted.
The aftercare I received, it was really helpful. We had a psychologist ready to see us after the show just to make sure we weren't off the rail.
The positive aspects were the confidence I gained from it and the lessons I learned from the people around me. It definitely made me more happy being in my own skin.
Olivia has mixed feelings when it comes to exploring the link between mental health and reality TV.
It's sticky because as much as reality TV is a good thing because it makes people more comfortable with the way they look and sexuality and so forth, I do also think that they have to take responsibility for all these deaths. And I think because being someone that has suffered with mental health, I think it's more the mental health side that's ultimately got neglected, because we can all feel a certain way but not speak about it. And it's that not speaking about it that perpetuates it even more. Once we all as a society understand, the needs of treating mental health and how important it is, then I think media wouldn't be an issue, reality TV wouldn't be an issue because we're all educated.
Now, with the nation closely inspecting reality programmes, it appears almost certain that contestant welfare will be at the forefront of discussions for the foreseeable future. If you are affected by any of the issues raised during this discussion, help can be provided through Public Health England by visiting the gov.uk website for more information.